All right, Happy New Year. Sorry, we had some technical difficulties, but we're here live from UCI Mind. Happy New Year. Welcome to the first episode of our 2020 Facebook Live series, where live viewers have the opportunity to ask questions of our nation's leading experts in Alzheimer's disease and related dementia research. My name is Chelsea Cox. I'm your host for this series and the Associate Director of Education for UCI Mind, which is a collaboration of over 100 researchers and staff at University of California, Irvine, who are at the forefront of solving Alzheimer's disease and related brain diseases. Now, this series is a live monthly Q&A session with our experts, and today I'm very excited to be joined by my mentor and the Director of UCI Mind, Dr. Joshua Grill. Welcome, Dr. Grill.
Thank you.
And thanks for your patience with the technical issues. Now, today in this first episode, we're going to be discussing and addressing a very ever-burning question. When are we going to have an effective treatment for Alzheimer's disease? Perhaps a timely question given the new year and new beginnings. So before we delve into this topic, though, I'd like to take the opportunity to briefly introduce Dr. Grill to all of you. Dr. Grill earned his doctorate in neuroscience from the Wake Forest University School of Medicine, and he currently serves as Associate Professor of Psychiatry and Human Behavior and Neurobiology and Behavior at the University of California, Irvine. As I mentioned, he serves as Director of UCI Mind, and he's also Associate Director of our NIH-designated Alzheimer's Disease Research Center, which is one of only 30 such centers across the nation and the only center in Orange County. Dr. Grill also leads the Recruitment and Retention Unit for the UC Irvine Institute for Clinical and Translational Science. And on top of all of these important roles and responsibilities, he runs a productive research program here at UCI Mind that focuses on clinical trials across the spectrum of Alzheimer's disease. And he has published numerous important findings on clinical trial design, recruitment and retention in clinical trials, as well as research ethics. So again, Dr. Grill, welcome. Thank you for joining me. And thank you to all of you who are attending live today and for your patience as we go live. Now, we encourage you to participate in this live Q&A series by typing your questions for Dr. Grill into the comments box that is connected accompanying this video. Please do note, however, that whatever you post is going to be linked to your name and visible to others. So please post responsibly and try to keep your questions as general as possible rather than personal. And to get us started, as people type their questions, I have a few questions first for you, Dr. Grill. So first, we're talking about treatments for Alzheimer's disease and when we're going to have an effective treatment. Are there currently any FDA-approved treatments for Alzheimer's disease?
There are, and before I talk about them, I want to also say Happy New Year to all of our UCI Mind community members. We're very excited about 2020 here at UCI Mind. It's our 25th year as an organized research unit at UC Irvine, and we hope you'll pay attention as we look for ways to celebrate this important anniversary for our organization. Lastly, I want to say, Chelsea, you're doing a great job with Facebook Live, and we're really excited about reaching people in new modalities. So the answer to your question is yes. Thankfully, there are some FDA-approved treatments for Alzheimer's disease. They are used by our clinicians here at UCI and around the world to help patients deal with the symptoms that come with Alzheimer's disease. They largely exist in two classes of medications, what we call cholinesterase inhibitors and a drug called Namenda or memantine. And the reason we have those treatments is that we were able to show in very important studies called clinical trials that they offered a benefit to patients who took them compared to a control group. Unfortunately, we haven't had a new drug for Alzheimer's disease in more than 15 years. And there's a lot of optimism in the field, there's a lot of enthusiasm about things that are still being tested, but there's also still a lot of work to do to come up with the next FDA-approved drug for Alzheimer's.
Yeah, 15 years is a long time. And, a lot of times we see in the media that there's these these supplements or other types of treatments that might work to help slow the progression of Alzheimer's disease or prevent it. Is there anything out there like that?
Well, it's important to say that we see a lot of things in the media or on the internet that make claims about offering benefits for patients. And the only way we really know if something can help patients is through rigorous study. And again, that's through these particular types of research studies called clinical trials. Anecdotes, other people's experiences, even sometimes things that come from research where we look back over the history of medical records or epidemiologic studies. Those can be important guidance for generating hypotheses or identifying potential targets for treatments, but only when we do the rigorous studies where we set out to adequately test whether something is helpful can we really understand if something should be used to care for patients. And sadly, beside those FDA-approved drugs, the cholinesterase inhibitors, Aricept, Exelon, and Rezidine, and memantine, nothing has been shown to offer a benefit to patients either for treating the symptoms of Alzheimer's disease, slowing the symptoms of Alzheimer's disease, or preventing the symptoms of Alzheimer's disease. There's some promising things that people can do to try to lower their risk, and they mostly center around lifestyle interventions, which I think some of our other sessions have really focused on. But now the field is taking important steps for doing clinical trials of things like exercise and diet and cognitive training and even multi-pronged approaches to these things. And again, those studies are essential to guide the recommendations we make to people about how to lower their risk or try to slow the course of the disease.
Yeah, well, it sounds like Alzheimer's disease is a really tough disease to study, and doing clinical trials for it is pretty difficult. So, why, among those reasons, why is it taking so long for us to find effective treatments?
Yeah, well, the first reason is science is hard, and finding improvements for the way we care for patients is a difficult, laborious process that faces a lot of challenges. Clinical trials for Alzheimer's disease have been tough for a number of reasons. We're still learning about the disease and what's happening in the brain of a person who suffers from this disease. We're still learning about what the right targets are for drugs. And we know that it's a complex disease. There's a lot happening in the brain of a person with Alzheimer's disease. We've spent a lot of energy studying plaques and tangles, the two hallmark pathophysiologies of Alzheimer's disease, but we know that there's other things happening in the brain, and different people have different opinions about how important it'll be to target those other things when we think about treatments. Most notably, we think about vascular changes in the brain, the blood vessels in the brain changing with the disease, and the inflammatory effects of the plaques and tangles in the brain. And it's possible that we'll have to treat all of these things to really reach our ultimate goal. In addition to the complexity of the disease, clinical trials face unique barriers in that it's really hard to do these studies. The studies are complex unto themselves and increasingly so. And we study the fact that one of the major challenges to doing these clinical trials, which are the only way to find the better therapies, is that not enough people participate. In Alzheimer's disease, we actually exclude a large portion of patients from our studies in order to make sure we're rigorously and carefully answering the scientific questions. Sometimes that's because we don't want to put people at unnecessary risk. Sometimes it's because we're worried that they won't help us answer the scientific question. Most people don't know about clinical trials, and a lot of people don't understand clinical trials. Recent surveys find that most Americans don't actually understand that medical advances only come through clinical research. And so there's a lot of work underway to try to help people understand the importance of these studies, make people aware that these studies are happening, and to link people who might participate in a study with studies that are ongoing.
Okay. Could you speak to some of the work that's ongoing here at UCI MIND to
Sure. Well,
achieve that?
Of course, we at UCI MIND spend a lot of time and energy trying to connect with our local community. We do that for a number of reasons. We want people to know what we're learning, so that if we learn that things we can do in our diet or exercise routine can help people lower risk, we want them to do those things. But of course, we also are hoping people want to support our mission and participate in research. We do that through community outreach and educational sessions through social media and things like Facebook Live. And of course, we've created a new tool called the Consent to Contact Registry, or C2C, where people can go online, tell us a little bit about themselves, including the types of research studies they'd be willing to participate in, so that we can then try to match them to studies that might be right for them and are looking for participants. And that certainly includes our Alzheimer's disease clinical trials and natural history studies being done by UCI MIND and the ADRC, but we don't limit to that. We make this tool available to essentially every investigator at UC Irvine who has IRB approval to use it. And so we really want to help research in a multifactorial way.
Yeah, I know I myself am signed up for the registry in hopes that I can help in any way. And it looks like we have a question here from one of our viewers, kind of related to what we're talking about. Does UCI MIND currently have any clinical trials that OC residents can join?
Yeah, there's always clinical trials, hundreds of clinical trials happening at any time, and we're constantly inviting people from the C2C registry and through other channels to participate in clinical trials. Here at UCI MIND, we have some exciting studies ongoing, and they really kind of span the whole spectrum of Alzheimer's disease. What I mean by that is we have studies that are looking for people who have a diagnosis of Alzheimer's disease dementia. We have studies that are looking for people who have a diagnosis of mild cognitive impairment. And we have studies that are looking for people who are older, in their 50s, 60s, 70s, and 80s, but don't have a diagnosis. Maybe those folks are concerned about their memory, maybe they're not. And we will have some new, very aggressive prevention clinical trials coming online in the next couple months that look at whether drugs can actually prevent people from ever developing memory problems. So, again, there's always a lot of activity at UCI MIND and beyond, and the more people stay in touch, tune into our programming, and enroll in the registry, the more they'll be first in line for new studies and exciting ones at that.
Okay, so would you say that enrolling in the registry is the best way to learn about and be recruited for these kinds of studies?
As the architect and principal investigator of the registry, I'd have to say that that's one great way to make yourself aware of studies ongoing at UCI MIND in particular. It's certainly not the only way, and we always encourage people to look at our website, UCI Health, clinicaltrials.gov, the NIA website. But yeah, we put a lot of energy into trying to make sure that people who enroll in the registry are kept aware of studies.
Okay. And just to give everybody the website for the registry, and I'll write it into the comments box at the end of this session. It's www.c2c.uci.edu. And then also to learn more about the specific clinical trials that are happening at UCI MIND, you can visit our website at www.mind.uci.edu. Looks like we have another question here from a viewer. Do you have an age limit for clinical trial volunteers?
So it's a great question. In the registry, we only require that people are adults. So we only accept people who are 18 and older with no upper age limit for being in the registry. For clinical trials, generally clinical trials will have specific age requirements, and that's going to be on a case-by-case basis. That is, on a study-by-study basis. So a very specific clinical trial will have specific ages that it includes. In Alzheimer's disease, from time to time, we do studies where there is no upper age limit. As long as people meet all of the other criteria to be in the study, their age doesn't matter. And of course, at UCI, we're home to one of the world famous studies of people who are in their 90s and their hundreds in the 90 plus study, where your minimum age to be in that study is 90. So there's no ageism here. But again, it's an important point, because age is only one way that we determine who is and is not eligible to be in a clinical trial. Age matters, but other things I would say matter more. First and foremost, we're looking at people who either do or don't have a very specific diagnosis. In our case, do you have a diagnosis of Alzheimer's disease? Do you have a diagnosis of mild cognitive impairment? Or do you lack either of those diagnoses in the case of prevention studies? Then we're going to look at other things that are driven in large part around safety. What medications do you take? Is it safe for us to test the medication in you if we're concerned about potential interactions between the thing we're testing and the other medications that you have? What other diagnoses do you have? Have you had cancer? Are you a good candidate to be in this study? It's an extensive process. And in the registry, we collect some data to really start that process. But ultimately, it boils down to coming in, having a visit with the research team, and doing a more comprehensive evaluation of a person's medical history. Okay.
Now, are there any treatments currently being tested that you find particularly promising?
So I think an important thing to say is that we don't do clinical trials of anything we don't find promising. We just we would never even begin the process of testing something that we didn't think was promising, that was going to move the field forward and was important for us to undertake. So certainly every clinical trial being done at UCI MIND is of something we hope is promising. It's been 15 years, so we've tested promising things that haven't yet panned out, and we can't offer promises or guarantees. That said, the field of Alzheimer's disease research has come a long way in a short time. We know so much more about this disease than even when I began my career as an Alzheimer's researcher 13 or so years ago. And we're testing very targeted interventions that we hope have direct effects on the pathophysiology of this disease. And of course, there's been major headlines about drugs that can clear plaques from the brain, which is a terribly exciting advance in our approach to treating this disease. And now it's the question of whether that will be adequate for slowing the disease. I can say that even if plaque clearing drugs are adequate to slow the disease, we won't be done. There's still the need to stop the disease in its tracks or even reverse it someday, we hope. So anti-plaque, anti-amyloid drugs are certainly promising, but we still need anti-tangle drugs and drugs to treat the inflammatory aspects of Alzheimer's disease, and potentially drugs to treat the vascular component of the disease as well. So there's a lot of work left to do, and a lot of promising candidate drugs that we're bringing into clinical trials now.
Okay, and some of those things that you just brought up, the vascular contributions and inflammation, we do have Facebook Live episodes coming up on those topics too, if you want to learn more about those aspects of the disease. So I know it's a complex and difficult question to answer, Dr. Grill, but how close do you think we are to having an effective treatment for Alzheimer's disease? And what are the things that give you the most hope?
Well, I think we're close. It's well described in the media that one company presented data in December, and they intend to submit for FDA approval for a new drug, aducanumab. That company is Biogen. It's unclear whether the FDA will entertain that submission or approve that drug based on the data that's available currently. I do think that Biogen's drug aducanumab looks very promising. I expect that it'll take it one more clinical trial before FDA approval is achieved, but if things go the way they have been going, then perhaps that will be the first disease-modifying therapy approved for Alzheimer's disease, and certainly that could occur in the next few years. There are other drugs that seem to have similar effects to that of aducanumab, and drugs that work on entirely different aspects of the disease, targets of the disease in the brain that will similarly be very important to test and hopefully can demonstrate efficacy in the next 5 years. So Admittedly, I've been saying this for several years, but I do believe we're less than 5 years away from the next FDA-approved drug for Alzheimer's disease.
I hope so.
Me too.
All right, well, that's all the time that we have for today. Dr. Grill, I want to thank you again for joining us and answering questions from our viewers live. We hope you join us for future episodes in 2020, the first Friday of every month, again at 11 o'clock in the morning Pacific Standard Time, same place on our UCI Mind Facebook page. Next month, February 11th, I will be joined by sleep medicine expert and director of UCI's new sleep center, Dr. Ruth Banka, who will discuss whether we're getting enough sleep for our brains. I'm sure I'm not, but we'll be very interested to hear from Dr. Banka, and she'll be excited to answer your questions live. In the meantime, I mentioned this earlier, but if you want to learn more about the exciting research that's happening at UCI Mind and some of our other education events and outreach opportunities, you can visit our website at mind.uci.edu. And then last, and again most importantly, if you want to help researchers by participating in important studies at UCI, you can visit our Consent to Contact registry page and sign up at c2c.uci.edu. Thanks very much, and we hope to see you next month. Bye.